My name is Lynn. I'm a dietitian, mainly seeing oncology cases.
Hello, I'm Suwan dietitian. My special interest is renal.
Hi, I'm Charlotte. I'm a dietitian working at NUH and my area of specialty is in pediatrics.
Hello, I am Denise. I am a dietitian from NUH. My area of specialties are peds, obese, and eating disorders.
My name is Shuning and I'm Valerie. My area of specialties are weight management and eating disorders, and mine are diabetes and eating disorders. Nutritionists and dietitians are both experts in nutrition and health. However, dietitians are trained to give medical nutrition therapy to help treat medical conditions. And also, in order to practice as a dietitian in Singapore, one would need to have a qualified bachelor's degree. Dietitians are able to work in a hospital as they are trained specifically to work with patients with medical conditions. Yeah. On the other hand, nutritionists often provide public health advice and mainly work in private organizations, community health, pharmaceutical, education, or media positions.
When a patient sees a dietitian, right, we will provide guidance on what to eat and what to avoid to help them to kind of optimize the effectiveness of the cancer treatments.
We also explain the reason for the advices given so the patient can understand better and also more likely they will comply better. So do you get a lot of patients that ask a lot of diet related questions?
Yes, yeah. So I do get a lot of questions, especially amongst my cancer patients. I think understandably they are more anxious and they want to know a lot more about diet. So the patients often come across like dietary myths, like the sugar really feed cancer cells. So they will kind of adjust their diets and become much more restrictive. And these actually cause more confusion and stress, and they subsequently lose a lot of weight and become malnourished. So to a certain extent, sometimes doctors may actually also delay their treatment because they are deemed unfit. In such cases, actually, as dietitians, we will present to the patients like what are the scientific evidence behind these myths, and then make sure that they understand that it's important to have a variety of different foods in their diet.
We also help patients to eat better, and as a good nutrition actually can really improve their quality of life by providing enough energy to carry out their daily activities, and also they feel less tired, and also they can have a better mood and feel less discomfort. When we start to see our patients, right, we will check their past medical history first. Okay, then afterwards we will conduct a full nutrition assessment, actually have the component of A, B, C, D.
So other things we also look at are some of the possible causes of poor intake. So for example, for my patients especially, they tend to experience nausea, vomiting, diarrhea or constipation, and then dysphagia as well, difficulty swallowing, and also mucositis, a lot of oral ulcers in the mouth, and then taste change also.
For the last one, D actually stands for dietary intakes. So actually dietitian actually will take a very detailed diet history. Dietitian will take a very detailed diet history to find out what type of patients taking, or any food allergy or any intolerance, or they're taking any like herbal products or any supplements.
So what's also important is also to be aware, for dietitians to be aware of patient's social history. So it's important for us to know if there's anyone helping the patient, like preparing their meals at home, or also if the patient requires any financial subsidies for their nutritional supplements.
So after we collect this information, dietitian actually will provide a meal plan, a care plan, which include the dietary advice to patients or caregiver, and also recommendations suitable for their nutrition supplements, and also adjustment for the hospital meal as well.
For example, a malnourished head and neck cancer patient on chemotherapy and radiotherapy. Okay, so the role of a dietitian is extremely important for these patients because they experience a really tough treatment-related side effects. For example, loss of appetite, nausea, vomiting, painful mouth ulcers, and so they can't really swallow, taste change, dry mouth as well, and difficulty of swallowing, diarrhea, constipation, and so on. Okay, so all these side effects can actually affect the ability for them to eat well. Dietitians will actually provide tips on how to better manage these side effects, advise them on food hygiene and safety for those patients on chemotherapy because their immune systems are compromised.
What is also very important is recommends appropriate food texture and also introduce nutrient-dense food for the patients so they can tolerate better, especially when they experience painful swallowing issues. On top of that, we also recommend different types of oral supplements to optimize their nutrition when the diet alone are unable to meet their requirements.
So another thing is also quite common amongst this group of patients is that they may require nasogastric tube feeding. That means actually a tube through to feed the milk to optimize their nutrition, especially for those who cannot really swallow with severe mucositis.
So we believe in close multidisciplinary teams relationship. So we often communicate with doctors to ensure patient actually get suitable treatment. Like for example, if current oral intake is inadequate and nasogastric tube feeding insertion is recommended.
Yeah, so to summarize, actually a dietitian will personalize the nutrition plan to each of our patients, and it changes through their chemotherapy or cancer treatment.